बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलामुअलैकुम। आप देख रहे हैं DTVNN। मैं हूं ताबिंदा गुल। आइए नजर डालते हैं अब तक की खुसूसी रिपोर्ट पर। 6 दिसंबर को एथनिक मीडिया सर्विस ने एक कौमी ब्रीफिंग का इनेकाद किया, जहां माहिरीन ने मेडिकेटेड चिल्ड्रन हेल्थ इंश्योरेंस प्रोग्राम CHIP और सप्लीमेंटल न्यूट्रिशन असिस्टेंट प्रोग्राम SNAP के हवाले से मुमकिना बजट कटौतियों पर बात की, जो 85 मिलियन से जायद अमेरिकन को मदद देती है। माहिरीन, जिसमें जॉर्ज टाउन यूनिवर्सिटी की जॉन एल्कर और चिल्ड्रंस पार्टनरशिप की मायरा अल्वारेस शामिल थी, इन अहम प्रोग्रामों पर मुमकिना खतरात के बारे में खबरदार किया, जहां खास तौर पर सदारती एम्पावरमेंट प्रोसेस के इस्तेमाल के हवाले से जो कांग्रेस की मंजूर शुदा फंड्स को रोक सकता है। ये ब्रीफिंग इस बात पर जोर देती है कि इस सियासी तब्दीली के दौरान कमजोर कम्युनिटीज के तहफ़्फ़ुज़ को यकीनी बनाया जाए। इस अहम मसले पर मज़ीद क्या कहा गया, आइए देखते हैं इस वीडियो में।
Good morning, everyone. Welcome to today's Ethnic Media Services News Conference. I'm Sunita Sarabji, Health Editor at Ethnic Media Services, and your moderator today. As President-elect Donald Trump prepares to take office, several federal health programs may face budget shortages as the new administration aims to reduce inflation and debt. These cuts are likely to take aim at Medicaid, the Children's Health Insurance Program, also known as CHIPS, and the Supplemental Nutrition Assistance Program, among other safety nets. These programs collectively serve over 85 million people in the US, including many of your readers and viewers, which is why this call is so important today. Speakers this week will discuss the impact of budget cuts to these critical health safety nets. They will also discuss the consequential impoundment process, which basically allows the president to simply stop the flow of funds to programs authorized by Congress. So we're honored to host an esteemed group of experts. They are some familiar faces: Joan Alker, Executive Director of the Center for Children and Families and Research Professor at the Georgetown McCord School of Public Policy Foundation. Joan will discuss potential cuts to Medicaid.
Thank you, Sunita, and very glad to be here with all of you today and to touch on this really important topic. So, as I've been saying a lot recently, Medicaid was not a topic that came up during the presidential campaign. There was basically no mention of Medicaid by either presidential candidate, but it has been on the minds and spoken about many times since the election, and unfortunately in the context of potentially big cuts. So I'll come back to that, of course, but let me start by just giving a very important top line about what Medicaid is and what it does. So Medicaid is the program here in the United States that serves low-income people, low and moderate income people, and also plugs some gaps in the Medicare program, which is the program that provides health insurance to primarily senior citizens. So Medicaid is performing many functions. I often call it the backbone of our healthcare system. It is the largest payer for long-term care. And so that is a very important piece of the program. It's a very costly piece of the program. And it's something that Medicare does not provide on a long-term basis. So Medicaid has to wrap around Medicare to provide long-term care for seniors and people with severe disabilities. Medicaid is also paying the cost sharing for low-income seniors for them to be able to access their Medicare benefit. So those are people we call the dual eligibles.
All right, Myra, then.
Yeah, I can address that. So first and foremost, the coverage of undocumented immigrants in Medi-Cal is paid for by state funds. So it's important to know that right now federal dollars are not covering the full scope Medi-Cal coverage for undocumented Californians. There are other components of the Medi-Cal program that is emergency Medi-Cal, that is part of federal law, but for the California expansion for full scope coverage, those are state dollars. I don't want to say that it will have no implications because a third of California's entire budget is reliant on federal dollars. So there is risk when federal funding are reduced for California, that California policymakers with input from the people, from advocates, will have to consider what does that picture look like moving forward. And that's part of the calculation and the risk that we're undertaking as we move forward into this next phase of the Trump administration. So I don't want to say one way or another that absolutely not, but it's something that we are all fearful of given the potential reduction in resources from the federal level.
Thank you. Joan, thank you. And will you please stick around for a final round of questions? Thank you. We move on to Mayra Alvarez, who will discuss the implications for children if budget cuts do come into effect. Welcome, Mayra.
Thank you so much, Sunita. And good morning, everyone. Thank you for the opportunity to be here with you. Again, my name is Mayra Alvarez, and I'm the president of the Children's Partnership. I want to give special thanks to EMS for holding this conversation and to each of you for the work that you do to inform our communities and their families about these policy changes or potential policy changes and the impact.
Thank you. There's another question, I think for both of you. Project 2025 recommends work requirements for accessing Medicaid. How practically would that work? And do you expect Trump to take on this Project 2025 proposal? Joan, if you want to start.
Yeah, sure. I can speak to that. So Project 2025 recommends many things. That's one of them. Project 2025 has proposals to block grant or cap Medicaid, which is the most catastrophic thing that could happen. So if that were to happen, work requirements are small potatoes compared to that. But having said that,
thank you. Henrietta Burrows and Araceli Martinez have questions, but I have a question for Mayra before we go to them. Do you expect to see cuts in the federal school lunch program as well?
As I think, similar to Joan's comments, there are a lot of concerning changes and cuts to programs that support basic needs, including school lunch programs, including, again, food stamp programs, WIC, as part of Project 2025. Has there been a specific proposal put on the table? Not yet, but this is part of what we're exploring.
Will you please speak to that before you present your remarks?
Yes, briefly. I know more than I wish I did about impoundment, including what's legal and what's not legal. And most of what I hear would be not legal. So the question is, and I can't answer this question at all, whether the administration will try to do things that violate the law or whether they'll try to use the law correctly but to their advantage. In my discussion, I'll explain what that means. But my quick answer is, I don't know. And I imagine that half the people talking publicly about this have no idea what they mean, much less what they think is legal.
Interesting. So we welcome you now, Richard, for your formal remarks.
Well, thank you very much, Sunita.
Richard, fantastic. That explains a very important and consequential procedure that I'm sure a number of us had no idea about. So we very much appreciate your insights. We have some questions for you, and then I have a question for you as well. We go to Elena Kuzetsnova of Slavic SAC. Elena, please ask your question.
Okay.
There you are.
Here I am. Thank you, Sunita, so much. I have a couple of questions. The first question refers to Ukraine. So as you know, Trump denied funds going to Ukraine, which Congress already allocated. So what do you think going to happen to those funds? Will he really impound the funds dedicated to Ukraine? It's first question. And the second question is, It's about COVID-related COVID relief programs. I read somewhere that Trump wants to recall the funds already distributed among the Americans, and those are billions. And do you think it's gonna work? Do you think it's gonna happen? And if yes, how? Thank you so much.
So those are good questions. Let me take them in part. Back in the previous Trump administration, when Trump impounded funds that had been appropriated for that year to go to Ukraine, where I might add my grandmother was born, he did not tell Congress about that. He did not follow the Impoundment Control Act. He did it for purely political reasons, trying to get Ukraine to publicly say bad things about Biden. When it started leaking out that the funds weren't going out, Congress asked GAO, some people in Congress asked GAO to look into it.
ये थी अब तक की खुसूसी रिपोर्ट। मिलते हैं अगले बुलेटिन में कुछ मजीद खबरों के साथ। देखते रहिए देसी टीवी USA, DTVNN, हमारा OTT प्लेटफॉर्म DTV Flix, जहां आप 3000 से ज़ायद चैनल्स देख सकते हैं। सो स्टे ट्यून्ड एंड स्टे विद अस।